Hello, my name is Angela, and I am presenting my interview with Renato um, over the French healthcare system. Renato has lived in both New York and Paris, and now having been lived in France for the past 10 years. We first had a general discussion over what it's like to be a resident in Paris and how the French medical system has been for him. He had responded that he has had very positive experiences with the French healthcare system compared to the US. It was very easy to use, especially with the upcoming use of Doctolib. And before Doctolib, it was still pretty easy to understand. Um, he had never really been worried about a health issue in France, nothing related to costs or coverage or accessibility. And having lived in New York before, he had talked about how expensive US healthcare is. He was lucky enough to have had a work that offered some sort of insurance. So that was not an issue for him in America, but he had had a lot of friends who had experienced negative things with the US healthcare system. And so overall, he is very happy with the French healthcare system and has used it quite a lot and feels that it is pretty easy and accessible. And this is just an overview of what we had previously talked about in class, just to remind us of where France lies in sort of like the medicines skip due to cost, because a large difference between France and a lot of other healthcare systems, primarily the United States, but prescribed medicine, as Renato had brought up to me, is completely covered with the France medical system. The overall perception of the system, Renato described it as a positive experience from his family and friends in France. There were very little conflicts over the health system, besides a couple exceptions, which were mainly over how the system was potentially being abused. For example, Renato described French people's cabinets as being full of random prescriptions because it's free and easy to find a nearby pharmacy and grab them. And so there are viewpoints of how the system can be seen as wasteful, and since so many people are going to the doctor, since it is free, they're going for smaller issues and potentially making wait times longer. But overall, Renato expressed that he was very grateful that finances weren't an issue, and I believe that's a general perception of a lot of people in France, and seeing healthcare as a universal human right and being covered. The main pros and cons of the system, the pros are that the doctor's visits, the prescriptions, the medical care is all covered under the universal coverage. The system seems to be easy to understand, even for myself when I had first come to France and needed to go to the doctor. Um, and the Renato had brought up multiple times that there doesn't seem to be a discrimination of race or class. Everyone could access services, and there's even additional help with unemployment. The cons, on the other hand, are what I explained previously of potential overuse of the system and then longer wait times, which is quite universal though. But Renato had expressed that it had been difficult to schedule appointments and the lack of doctors. You might need to wait 3 months to schedule a specialty doctor. And he had also mentioned something very interesting that I hadn't thought of how doctors in France seem to be potentially a little less attentive to patients than um, doctors in America. For example, in America, Naoto constantly got emails and reminders to get vitals checked. The doctor would ask him if he wanted these tests, but he had expressed that his experience in France was a little different in a sense that he would need to really keep nagging the doctor in order to get a test. And for example, the doctor had said, "Oh, you don't need this test." He waited 2 years while he felt like in America, the test would have been given maybe every 6 months. Um, and so that might be also tied into the potential overuse of the system, and uh, that being covering the pros and cons. We do see France in this image here having overall ranking of second to last in healthcare system performance. Um, and though the accessibility and uh, accessibility and sort of in both location and cost are good in France's medical care system, but there have been different things with the overall care process and general satisfaction of the performance. And some things I noticed were that through the interview specifically, that there are drawbacks of each healthcare system, but it seems like the universal healthcare system created mainly issues with discomfort and potential worries of the system being taken advantage of, while other systems that are not universal created more issues with coverage. And this relates back to the Iron Triangle of we can see that France prioritizes accessibility, while other countries might prioritize cost or efficiency. And we can see the outcomes of that being that a lot of people in France feel that they are able to reach out to a doctor, able to get prescriptions, but possibly the outcome or the process of it is not as comfortable, but the accessibility is very strong. And so thank you so much, Renato, for the amazing interview. And thank you all for listening.